Ever get that feeling like you want to really dive into something new? Not just skim the surface, but really like understand it. You know what I mean?
Yeah, absolutely.
That's what we're all about here. Today, we're going to be going deep on breathwork.
Cool.
It's something that I've been hearing more and more about. People are saying it can help with all kinds of things like stress, emotional healing, just generally feeling better.
For sure. And it seems like, based on what you've been looking at, especially on BreathFinder, that it has a ton of potential benefits, but you also have to be really careful and approach it in the right way.
Exactly. And for this deep dive, we really want to focus on that safety and the ethical considerations around breathwork.
Yeah, that's important.
Because you hear about all these possible benefits, right? Like less stress, dealing with emotional baggage, having more energy and focus, even improvements to your physical health. And it's really tempting to just jump right in.
Right.
But like with anything that can have a big impact, you have to be aware of the risks. So let's just get right to the point. Can breathwork be dangerous?
That's a good question to start with. Generally, when it's done correctly, and especially if you have some guidance, breathwork is safe for most people.
Okay.
But there are definitely some techniques and situations where it can get risky.
Okay, so let's talk about those risks. What kind of dangers are we talking about?
Well, one of the biggest things to watch out for is hyperventilation.
Yeah.
Some types of breath work involve breathing really fast, and if you do it too much or for too long, it can lead to hyperventilation.
Okay.
You might feel dizzy or tingly in your hands and feet, or even like you're going to pass out. And in some cases, it could even cause a panic attack.
Wow.
And that happens because when you're breathing so rapidly, you end up getting rid of more carbon dioxide than you normally would.
Okay.
And that can mess with your body's chemistry and cause those weird sensations.
That sounds pretty unpleasant. What else should we be careful about?
Another really important thing to be aware of is the possibility of emotional overload.
Oh, interesting.
Breathwork can be a powerful way to tap into really deep emotions.
Okay.
And for people who've experienced trauma, it can bring up some really intense feelings.
Right.
So without the right kind of preparation and support, that could be really overwhelming and even re-traumatizing.
Yeah, it makes sense. It's like you're unlocking something powerful and you need to be ready for what comes out.
Yeah, I'll do that.
So it's not just about the physical act of breathing, it's also about the emotional stuff that can come up.
Yeah, exactly.
And on the physical side, we also need to think about the strain that some of these techniques can put on your body.
Right. Some techniques involve holding your breath for a long time or breathing really forcefully.
Okay.
And that can put stress on your heart and lungs. So it's especially important for people with any kind of heart or lung problems to be extra careful.
Yeah, that makes sense.
Basically, anything that affects how your body handles oxygen, blood pressure, or how you deal with emotions is something to think about carefully before doing breath work.
So we've got potential issues with breathing too fast, the emotional intensity, and the physical strain. Anything else on the danger list?
Yeah, there's one more thing. Some breathwork techniques can cause altered states of consciousness.
Interesting.
This can make you feel kind of different, maybe spaced out, or like you're having weird sensory experiences.
Okay.
And while some people might be looking for that kind of experience, it can be really disorienting or even scary for others, especially if they have any underlying mental health conditions.
Right. So even if you're doing everything right, are there still side effects that could happen?
Absolutely. Even if you're doing it correctly, some side effects are pretty common.
Okay.
Like we were talking about with hyperventilation, you might feel dizzy or lightheaded.
Right.
That's just because of the changes in carbon dioxide levels
Right.
when you're breathing deeper or faster.
Okay.
That's why it's often recommended to lie down or sit during breath work.
And what about that tingling feeling? They call it tetany, right?
Yeah, tetany. That's the tingling in your hands, feet, or face.
Yeah.
It's usually caused by hypoventilation too.
Oh, okay.
It's usually temporary, but if you're breathing really forcefully for a long time, it can sometimes even lead to muscle cramps.
Okay. So those are some of the physical things. What about the emotional side? Like we talked about earlier, there's that potential for emotional release.
Yeah, exactly. Breath work can definitely bring up emotions.
Right.
You might find yourself feeling sad, angry, or even crying.
Okay.
And while that kind of release can be really good for you, it's super important to make sure you're doing it in a safe and supportive environment.
Yeah.
We don't want to overwhelm ourselves or end up feeling worse.
It makes sense. And I imagine that after a really intense session, you could feel pretty drained.
Yeah, definitely. Fatigue or exhaustion is another possible side effect,
Yeah.
especially after a long or intense session.
Okay.
It's kind of like a workout for your cardiovascular system. Even though you're just lying there breathing, it can really take it out of you.
So this brings us to a pretty important question. Are there certain people who should avoid breathwork altogether, or at least be really careful about it?
Yes, there are definitely some people who should be cautious.
Okay.
And Breathfinder really emphasizes this. People with heart conditions like heart disease, arrhythmias, angina, or a history of heart attacks need to be extra careful because of the strain it can put on the cardiovascular system.
Yeah, that's really important to know. What about pregnancy?
Pregnant women should be careful too. It's generally not a good idea to do techniques that involve holding your breath, intense abdominal work, or hyperventilation.
Okay.
That's because it could reduce the oxygen supply to the baby
Yeah.
and put extra strain on the body.
Right.
Gentle breathing exercises are usually a safer bet.
Okay, so gentler options are better there.
Yeah.
And what about people with low blood pressure? Would they be more likely to get dizzy?
Yeah, definitely. People with low blood pressure might be more likely to get dizzy or faint during breath work,
Okay.
especially if they're doing rapid breathing or holding their breath for a long time.
Gotcha. And how about anxiety? It seems like breath work could be helpful for some people with anxiety, but maybe not so good for others.
Yeah, that's a really good point. Breathwork can be a great tool for managing anxiety for some people.
Right.
But for others, especially if they have panic disorder, some techniques, like rapid breathing or breath holding, could actually make their anxiety worse or even trigger a panic attack.
Yes, it's really individual.
It is. It's super important to start with really gentle and calming practices if you have anxiety.
And we touched on trauma earlier. How does that play into who should be careful with breath work?
Well, for people with a history of trauma or PTSD, breathwork can bring those experiences back up.
Right.
So it's super important to approach it cautiously and ideally work with a trained practitioner who can provide a safe and supportive environment.
So having that support is really key.
It is.
What about people with physical health conditions like asthma or other breathing problems?
They should also be careful. If you have a respiratory condition like asthma or COPD, you should avoid any breathwork practices that could make your condition worse,
Right.
like anything involving rapid breathing or breath holding.
So being aware of your own limitations is important.
Yeah, absolutely.
Are there any other conditions that people should be aware of?
Yeah, a couple more.
Okay.
People with a history of seizures should definitely talk to their doctor before trying breathwork,
Okay.
because some techniques could trigger a seizure.
Gotcha.
And people who get severe migraines might find that certain practices, especially ones that involve hyperventilation, can trigger or worsen their migraines.
Okay, so there's a lot to be mindful of. It seems like the general advice is if you have any health concerns at all, talk to your doctor before trying breath work.
Exactly. It's always better to be safe than sorry.
Right, definitely. So we've talked a lot about individual safety, but what about the people who are guiding these practices? What kind of ethical responsibilities do breathwork practitioners have?
That's a great question. It's a huge responsibility to lead a breathwork session.
Yeah.
You're in a position of power, and the well-being of the participants is in your hands. And Breathfinder in particular really emphasizes the importance of ethical standards.
Right.
The first and most important thing is informed consent and clear communication.
Okay.
Practitioners need to explain exactly what they'll be doing, what the risks are, and what people can expect to experience,
Right.
including any potential physical or emotional reactions.
So no surprises.
Exactly. Transparency is key.
And what else is important from an ethical standpoint?
Voluntary participation is crucial too. People should always feel like they can opt out of any technique or even the whole session if they're not comfortable.
Yeah, that's really important. They need to feel empowered.
Right. And then there's the issue of physical and emotional boundaries.
Yeah, that seems especially important in a practice that can be so personal.
Absolutely. Practitioners have to respect those boundaries.
Okay.
No physical touch without explicit consent beforehand. And being really sensitive to people's emotional states.
Right.
And if touch is part of the practice, the practitioner needs to clearly explain why and make sure everyone's completely comfortable with it.
It's all about building trust and making sure people feel safe.
Exactly.
And a lot of these practices come from different cultures. So how do ethics play into that?
Cultural sensitivity is really important.
Right.
Practitioners need to respect the origins of the techniques they're using
Okay.
and avoid appropriating them by acknowledging and honoring those roots.
Yeah, you don't want to take something and strip it of its meaning.
Exactly.
And what about the personal experiences that might come up during a session?
Yeah, breath work can bring up some really personal and even profound stuff.
Right.
Practitioners have to keep anything that's shared confidential
Okay.
and respect people's privacy.
Absolutely. And of course, the people leading these sessions need to be properly trained and competent.
Absolutely. Competence and ongoing training are non-negotiable.
Right.
Practitioners need to be committed to constantly learning, staying up to date on the latest research and best practices.
Okay.
And they need to be clear about their qualifications and any certifications they have.
Yeah, that makes sense.
They should also know their limits
Yeah.
and be willing to refer people to other qualified professionals if needed.
Right. So sometimes it's about knowing when to say, this is beyond my expertise.
Exactly.
And it's important to create a space where people feel safe to express themselves without judgment.
Yeah, absolutely. A non-judgmental and supportive environment is key.
Okay.
People should feel comfortable sharing their experiences without feeling pressured or criticized.
Right.
And practitioners should never push anyone to continue if they're feeling uncomfortable or distressed.
Yeah, it's really important to respect people's boundaries.
Exactly. The pace and intensity should always be based on what the individual is comfortable with.
It seems like breath work should be presented as one tool among many for well-being, not like a magic cure.
Yeah, I agree. Ethical practitioners promote breath work as part of a holistic approach to well-being,
Okay.
encouraging people to also consider their physical, emotional, and spiritual health.
So it's all connected.
It is.
So we've talked about the responsibility of the individual and the practitioner. What about the organizations that train these practitioners? What role do they play in all of this?
Training providers have a huge responsibility.
Yeah.
They're the ones setting the standards for practitioners.
Right.
Their training programs need to be really comprehensive.
Okay.
They need to cover not just the breathing techniques, but also the potential risks, contraindications, and ethical obligations.
Yeah, it's about more than just teaching the techniques.
It is. They need to teach practitioners how to handle potential side effects, respect boundaries, and ensure informed consent.
So they're shaping the next generation of breathwork guides.
Exactly.
Oh.
And they should be constantly evaluating and improving their programs,
Okay.
making sure they're training practitioners who are not only skilled but also ethical.
It's an ongoing process.
It is.
So before we wrap up, are there any common misconceptions about breathwork that we should address?
Oh, yeah. There are definitely a few.
Okay, let's hear.
One big one is that breathwork is safe for everyone no matter what.
Right.
Like we've been talking about, that's not true at all. There are contraindications, and it's super important to take them seriously.
Exactly. Another one I've heard is that once you're a certified breathwork practitioner, you're done learning.
Yeah, that's not true either. This field is constantly evolving.
Right.
So practitioners need to keep learning and stay up to date.
So ongoing education is key.
It is. And then there's this idea that the more intense the breath work, the better the results.
Yeah, I've heard that too.
That's another misconception. Intensity doesn't always equal better outcomes.
Okay.
Sometimes it can lead to negative experiences like hyperventilation or emotional overwhelm.
Right, so you have to be careful.
You do.
Yeah.
A slower, more gradual approach is often safer and more effective.
And what about emotional releases during breathwork sessions? Are those always positive and therapeutic?
Well, they can be really therapeutic, but they can also be overwhelming,
Yeah.
especially if someone doesn't have the right support.
Okay.
For people with trauma, it's really important to approach those experiences carefully.
And it seems like some people might think they can just learn advanced breathwork techniques on their own.
Yeah, but that's not a good idea.
Okay.
While some basic practices are okay to do on your own, anything more advanced should really be learned with a qualified instructor.
Yeah, you want to make sure you're doing it safely.
Exactly.
And do contraindications only apply to longer or more intense sessions?
Nope, they apply to any session.
Okay.
Even shorter or milder sessions can be risky for some people.
So it's always important to be aware of the contraindications.
Always.
And finally, are there any long-term risks with breathwork?
Well, it's generally safe when it's done correctly. But if you're doing things wrong, like chronic hyperventilation, it could potentially lead to problems down the line.
Okay, so it's really about being informed and doing it right.
It is.
So what we've learned today is that breathwork has a lot of potential benefits.
Yeah.
And Breathfinder highlights those really well. But it's also important to be mindful of safety and ethics.
Absolutely. Start slowly,
Uh-huh.
practice in a safe environment, Be aware of your boundaries and respect others' boundaries.
Right. And always follow those ethical principles we talked about.
Exactly.
And just another reminder, if you have any health concerns, talk to your doctor before you start breathwork.
That's so important.
So as we've been talking about the impact breathwork can have on our minds and bodies, it makes you wonder what other seemingly simple things in our lives might also have these really important considerations that we often overlook.
Yeah, that's a great question.
It's definitely something to think about. Thanks for joining us on this deep dive today.
It was my pleasure.
Until next time, stay curious and stay safe.